Cardiomyopathies classification. Cardiomyopathy is a heart muscle disease associated with cardiac dysfunction. It is classified according to the structural and functional abnormalities of the heart muscle. Dilated cardiomyopathy DCM, hypertrophic cardiomyopathy HCM, restrictive or constrictive cardiomyopathy RCM, arrhythmogenic right ventricular cardiomyopathy ARVC, and unclassified cardiomyopathy. Ischemic cardiomyopathy is a term frequently used to describe an enlarged heart caused by coronary artery disease, which is usually accompanied by heart failure. Regardless of the category and the cause, cardiomyopathy may lead to severe heart failure, lethal dysarrhythmias, and death. Dilated cardiomyopathy DCM is the most common form of cardiomyopathy. DCM is distinguished by significant dilation of the ventricles without significant concomitant hypertrophy, that is increased muscle wall thickness, and systolic dysfunction. DCM was formerly named congestive cardiomyopathy, but DCM may exist without signs and symptoms of congestion. Hypertrophic cardiomyopathy HCM. In HCM, the heart muscle increases in size and mass, especially along the septum. The increased thickness of the heart muscle reduces the size of the ventricle cavities and causes the ventricles to take a longer time to relax, making it more difficult for the ventricles to fill with blood during the first part of diastole and making them more dependent on atrial contraction for filling. HCM may be obstructive or non-obstructive. HCM had also been called idiopathic hypertrophic subaortic stenosis IHSS or asymmetric septal hypertrophy ASH. Restrictive cardiomyopathy. Restrictive cardiomyopathy RCM is characterized by diastolic dysfunction caused by rigid ventricular walls that impair ventricular stretch and diastolic filling. Systolic function is usually normal because RCM is the least common cardiomyopathy. Restrictive cardiomyopathy can be associated with amyloidosis, in which amyloid, a protein substance, is deposited within the cells, and other such infiltrative diseases. However, the cause is unknown in most cases, that is idiopathic. Arrhythmogenic right ventricular cardiomyopathy ARVC occurs when the myocardium of the right ventricle is progressively infiltrated and replaced by fibrous scar and adipose tissue. Initially, only localized areas of the right ventricle are affected, but as the disease progresses, the entire heart is affected. Eventually, the right ventricle dilates and develops poor contractility, right ventricular wall abnormalities, and dysarrhythmias. The prevalence of ARVC is unknown because many cases are not recognized. ARVC should be suspected in patients with ventricular tachycardia originating in the right ventricle, that is a left bundle branch block configuration on ECG, or sudden death, especially among previously symptom-free athletes. The disease may be genetic, that is autosomal dominant. So the family members should be screened for the disease with 12-lead ECG, Holter monitor, and echocardiography. Unclassified cardiomyopathies. Unclassified cardiomyopathies are different from or have characteristics of more than one of the previously described cardiomyopathies. Examples of unclassified cardiomyopathies include fibrolastosis, non-compacted myocardium, systolic dysfunction with minimal dilation, and mitochondrial involvement. Thank you.